Hi everyone, I'm Johanna Ravenhurst. I'm a PhD candidate in epidemiology working in Andrew Lemmer's lab. And I'm going to be talking today about Project Listen, investigating the experiences and challenges of public health and vector control professionals across New England. So the overarching research question for this study is what could NEWVEC do with our resources to help with integrated vector control and surveillance across New England? And within that research question, what are the barriers and facilitators to achieving the goals of this work in our region? And what are the main organizational and logistic barriers? So Dr. Lover already went over our sampling plan a bit in his talk this morning. So I'll just briefly say that so far, we are partway through this study. We have collected data in what we call Strata 1 of our recruitment plan, our sampling plan for this study. So the preliminary results that I'll be presenting today are based off of an in-depth analysis of the 12 individual interviews that were conducted amongst that group, and we are currently conducting data collection in the subsequent groups. For this study, we're using an inductive coding process, meaning that our beams are developed from what participants are telling us. So we're looking at detail at the data we collected through our interviews, and then we developed this list of preliminary themes. And just to give you an idea of the code book, this is one theme here, and all of the codes that are under that theme, and then the definitions that we use to apply those codes. One example of a theme is collaboration and relationships, and interagency coordination is under there. So we're hearing from people that open dialogue is key to effective interagency coordination, and weekly or bi-weekly calls are really important. There's also acknowledgement that mosquitoes and ticks aren't constrained by state borders, and so we need a regional approach to surveillance and control. And the context here was in terms of collaboration and communication amongst professionals working across the region. Educating the public is a code that came up under communication and influence. We've been hearing about many innovative methods for educating members of the community about how to protect themselves. And some, even as the person said in this quote, are even placing educating the public at a higher value above their own work, because they can't be everywhere at once. And so if they're able to educate people to protect themselves, then they can mitigate their own risks from vector-borne diseases. Under emotional and psychological impact, stress and pressure. So the people, this is the people working boots on the ground doing control and surveillance work. They have an increased workload during the mosquito and tick season. And they've been sharing, like, especially last year, for instance, it was a busy year. They were kind of burnt out, exhausted at the end of the year. And then it just didn't end. Tripoli positive pools started popping up, emu cases and, all these animal cases coming up. And so the work just didn't end when they were just ready for it to end. And somebody shared that they felt they couldn't even get up from the microscope because they needed to keep sorting mosquitoes and get them to the state to be tested. They've been talking about industry changes and adapting to industry changes, and how there's been an increase in competition in the field. And many people have noted there's these private companies that have been around for a while. Maybe they're family owned. Maybe they have, stronger connections with the community, have built a reputation. And then in the past 5 to 10 years, we've had more opportunistic pest control companies come in who maybe have different standards for the work that they do and fewer connections with the community. So it's just something they've been noticing. So some of our preliminary results include, I've already gone over a few of the things that have been going well in terms of regular communication and collaboration, team support, prioritizing staff safety, and this emphasis on education and knowledge sharing, not only with members of the public, but among professionals working in the field. Some of the frustrations and barriers that have come up our, public misunderstanding of the work, finding staff with specialized training, such as being able to ID mosquitoes, staff turnover, both internally and then also at other agencies, leaving a gap in institutional knowledge that somebody needs to fill. And then just gaps in information or communication. This is just a short overview of what we're seeing so far, but we do have a work in progress presentation scheduled for November 6th. We'll be talking about this quite a bit more. And I just wanted to give a huge shout out to our team at the Center for Program Evaluation here at UMass in the School of Public Health.